We're cautiously optimistic that at this moment, there's not reason to think that this virus is spreading in Wisconsin, and that we are not at risk of having much larger numbers. I say cautiously optimistic because what we don't know is the degree to which in other countries and in other states, community-based transmission will start to occur. Yes. So a week from now, we might be at a very different place. But right now, I think we're all on the same page in public health to say that the risk to the general population for this virus at this time is very low. The leadership of NIH has said optimistically would be that 18 months from now, we might have studies showing a effective vaccine is available. That's extraordinarily fast as far as general vaccine development goes. The ability to identify a target for a vaccine or the protein on a virus or bacteria itself that can even be leveraged in a way to create a vaccine sometimes takes decades. And of course, there are some viruses that we've been working very hard on for vaccines for years and have no promise. So HIV, for example, there's been billions of dollars spent at HIV vaccine research, and we still don't have one. So the idea that we could have a vaccine for coronavirus after just having discovered it in nature less than 6 months ago is extraordinarily exciting. It doesn't help us. We'd like to have one now, of course. But I think this is really medical science sort of at its most advanced in human history right now, to be able to identify a virus, get the genetic code, and translate that into a vaccine within less than 2 years would be a huge triumph. So that's the context. It doesn't mean that a vaccine is not going to help us stem the tide of this epidemic right now in 2020. We're going to have to do all the other things that we've been doing, which involves the standard public health measures like isolating people and getting people tested and respiratory hygiene and all the things that we're talking about.